Close to one-third of the population suffers from some form of chronic disease. This third of the population accounts for three-quarters of healthcare spending. This figure is expected to increase over the coming years due to aging population. Let's have a look at a healthcare institution. Paul, the general manager, is concerned costs are increasing and budgets are spiraling out of control. There simply aren't efficient means to treat chronically ill patients who create the highest cost of healthcare system. These patients might wait months for an appointment. Due to lack of medical monitoring, they also suffer from frequent imbalances that lead to a high number of hospitalizations and readmissions. Paul needs to help change the monitoring and relationship models, which enable him to improve patients' health. Helix Health is already helping to solve this problem. Our proposal involves providing Paul with a new interaction model for medical professionals and chronically ill patients, an integrative service that will help Paul monitor each patient remotely based on their specific needs. As a result, patients will feel better cared for, they will be better able to communicate more efficiently with their doctors, and they will know more about their diseases. Let's look at how this works in practice. Firstly, we need to agree with Paul and the medical team on the type of patients and diseases we will be focusing on in order to drive the change. We also need to define the key performance indicators that will help us analyze the results of this new care model. The next step is to divide up patients based on their diseases, risk level, and social environment to assign them the telehealth program that best matches their needs. Mark is 65 years old and suffers from chronic heart condition and respiratory problems. He needs to communicate more efficiently with his doctor and receive medical attention more frequently, but his next appointment might not be for 3 months. Mary, his doctor, makes an appointment with Mark to explain the benefits of this new service, and she designs a customized plan for him. Once Mark signs up for Helix Health Services, we recommend installing at his house the biometric equipment and communication devices which will enable him to interact with his doctor and send information about his health. We also show him how to use the service. From the comfort of his own home and virtually anywhere else, and according to his personal schedule, Mark measures his vital signs regularly, fills out questionnaires, and accesses training videos that Mary has chosen for him. If Mark's results go over a certain threshold, Mary, his doctor, receives an automatic alert. She looks at how his results have changed, she speaks with him regularly, and if required, adjusts his treatment plan. After some time, we review Paul's results and the impact of the care model. The preliminary results of our projects allow us to conclude that this new care model, based on telehealth and coordinated care, helps professionals to monitor their patients more effectively, thus avoiding imbalances, which reduce the number of emergency appointments and hospitalizations, and also manages to reduce the patient care costs, which are already among the highest in the healthcare system. And most importantly, this new care model helps to improve patients' health, quality of life, and create the peace of mind of their family members. Together we can achieve a more efficient and sustainable healthcare system which can cope with the challenge of having to manage chronic diseases.